My name is Dominique Mohammed. I'm 29 years old. I'm from Portland, Oregon, and this past year, I've faced and defeated one of the toughest battles that I've ever faced in my life. When I was 20 years old, I was diagnosed with Hodgkin's lymphoma stage 4. I'm gonna bring on fellow cancer survivors to show you guys not only that you can beat any cancer, but that you can beat your zombie, whatever that is in life.
Welcome to this episode of Beast vs. Zombie. I'm your host and cancer survivor, Dominique Mohammed. Today, we have my fellow cancer survivor, Larry, on the show. Thank you for coming on. He has an amazing, inspiring story about his battle of overcoming cancer. So let's get right into it.
Okay.
So how did you find out initially that you had been diagnosed with cancer?
Well, I originally was very, very exhausted about 4 years ago, which is totally out of the norm. I was working out twice a day, 6 o'clock in the morning before I went to work, and leaving work at the end of the day and going back into the gym. I didn't have any issues working out, none whatsoever. Later on in the evening, I would just be totally wiped out, just exhausted. So I was a resident of New Jersey at the time.
Okay.
And I was working with a friend, Jonathan Howard, a long-term friend, Jonathan Howard, and he recommended a hematologist that his mother was seeing. So I went to see that hematologist and a battery of tests, and we determined that I was anemic, number one, and number two, that my hemoglobin, after a series of visitations, my hemoglobin was going up and down. Some days it would be 12.1, another day it would be 13, another day it would be 9.2, another appointment it would be 7.1. So it was never stabilized. So his initial response to all of this fluctuation was, we have to keep our eye on it. Well, keeping our eye on it over a series of 3 or 4 years, I didn't know exactly what was going on, and he could never pinpoint what was going on. And as after I moved to Charlotte, I sought out a hematologist at Narbonne Health, and after a series of tests there, it was determined that I was diagnosed with MDS, which is Myelodysplastic syndrome, which is basically leukemia.
Okay.
So that was when I found out I had MDS. It was August 8th of 2022.
Okay.
And it was as though somebody hit me in the back of the head with a 2x4. Here I am, a guy that's always been active, bike rider, riding a racer, riding in competitive races in New York City, Central Park, riding in my town of Gillette, New Jersey. On the weekends, I was riding 25 miles through very, very hilly country. I was active, very active, and working out. You know, maybe I would take Sunday off, but I was in the gym twice a day for decades.
Okay.
So this diagnosis of MDS, and at the time, the word leukemia had never come into the equation. I was told, whatever you do, stay away from the internet. So, you know, this is what it is. I went back to work after being diagnosed. I called my wife, Marguerite, told her what was going on. And then she suggested that I call my identical twin nieces who are nurses. and get questions from them as to what I should be asking of these hematologists and oncologists.
Mm-hmm.
And I did. I called them, and they gave me questions. And later on, I found out, they tell you don't go on the internet. Well, your natural instinct is to go on the internet.
Google search.
First of all, MDS and, myelodysplastic syndrome. Oh, you can't even remember the terminology because you're hit with a 2x4.
Mm-hmm.
So the next thing I did was I sought out a second opinion. So I went back to work, and my partner, when I walked into the office, my partner said to me, so he could see my face reaction. So he says, so what happened? I says, I've been diagnosed with MDS. And he knew what it was. And he says, I said to him, I need to seek a second opinion because, you're hit with this 2x4 and all of a sudden, you want a second opinion.
Right.
So when I said second opinion, he picked up the phone in the office and called his friend who was the president of the Levine Cancer Institute.
Wow.
And gave him the history of our relationship. I've known Jonathan 45 plus years.
Mm-hmm.
We traded together at Merrill Lynch. We traded together I'm a corporate bond trader by trade, over 50 years. So we traded together in 3 different places.
Mm-hmm.
He called his friend, Dr. Derek Ragavan, who was the president of Levine Cancer Institute. He gave him all the information about our relationship. When he hung up the phone, that guy called me in 10 seconds.
Mm-hmm.
Immediately after speaking with him, he had called his head oncologist of hematology and oncology, whose name is Dr. Michael Grunwald.
Okay.
Dr. Grunwald called in like 15 minutes.
Mm-hmm.
So that was all God right there. God jumped in the picture like that.
Right.
So after a battery of other tests at Levine Cancer Institute, and I had been being seen by Dr. Patricia Croft at Norvant. So I was seeing 2 hematologists who were and oncologists who were working together at this point.
Mm-hmm.
So they decided that I needed chemo.
Mm-hmm.
And for those of you who don't know, this is cancer of the blood. So I underwent 4.5 months of chemo.
Okay.
I didn't have any side effects. I was still working.
Right.
No side effects. No diarrhea. No nothing. So after the 4.5 months, all of this was in preparation for a bone marrow transplant.
Mm-hmm.
My siblings were all tested, and I have a twin sister who's immunocompromised.
Okay.
I have 3 other siblings actually, that I found out about later on in life. Denise, Derek, and Debbie, and 2 of the 3 were 5 out of 10s.
Mm-hmm.
We found a donor in Europe who was a 10 out of 10.
Oh, wow.
So Dr. Grunwald mentioned that they were seeking a younger donor. And a younger donor, meaning 30, 40 years old, could be 20 years old. But my siblings are all in their 60s, and I'm 73 at the time. I was 71 years old. So we found the donor, a 10 out of 10, which leads to another situation where, let's go to Ancestry about that one. but I never did, but that's something on the horizon. But I underwent 4.5 months of decitabine, and at the end of those 4.5 months of weekly chemo, it was determined that it didn't do the job that they thought it was going to do to prepare me for a bone marrow transplant.
Right, because you have to be in remission.
And it didn't do the job. So the conversation came up about a clinical trial. Clinical trial and hit by a 2x4 all on the same street. So I agreed to do the clinical trial. The clinical trial was APG 2575.
Okay.
You don't know anything about a clinical trial. It is what it is. There's no real history about a clinical trial.
Yeah, you have no data.
No data. So I agreed to that. The clinical trial worked. There were some issues with the donor and the timing of him, the individual. I don't know whether it's a male or female, but the timing of the individual being able to donate marrow. So the bone marrow transplant was delayed 3 times.
Wow. Okay.
But I knew it was going to happen. And from the time I was diagnosed on August 8th of 2022, I took on the mantra of God's got this. And I stuck with it to this very moment. When I went into the hospital in March of 2023 for the bone marrow transplant, one of the first things I did was to write on the whiteboard in giant letters, God's got this. I was told that I would be in the hospital through this process 30 to 33 days. You know the drill.
Yep.
When I was in the hospital, it was a unit of 16 rooms. The air is, it's just a special floor where transplants are done. And the air is circulated every 10 seconds. There's no bacteria. There's no germs. There's no nothing. So I noticed that the room doors, some of the room doors had these little feet on them. And the feet, I asked one of the nurses, I says, what are those feet on these doors? And they says, oh, those are the people that walk after the transplant. And the more feet you see, the more you know that those people are walking, and they usually are out of here a lot sooner than 30 to 33 days.
Okay.
I'm a very competitive guy.
Me too.
You can't get more competitive than I am. I said, really? I walked out of that hospital in 27 days. Yeah. My door was full of feet. And the feet were little plaques like this. You just stick them on the door. But even during the process of this bone marrow transplant, you're sitting there and you're reading this mantra that you've taken on all day, every day. And if you don't have faith, I don't even know I don't even know how people make it
Right.
with no faith and no God.
Mm-hmm.
It was so comforting to know that God's got this.
Mm-hmm.
I remember having back surgery probably 22, 24 years ago.
Okay.
Avid bike rider, you know. Now you can't ride your bike.
Yeah.
Herniated disc. And I walked into that surgery totally blind.
Mm-hmm.
And I put my faith in God. Surgery went fine. I was out of work 6 weeks. Couldn't ride the bike for a year.
Mm-hmm.
Couldn't play golf anymore. Twitch, you know, your back's been twisted.
Right.
But I knew what happened during the back surgery with my friend God. See, you have to know God, and He has to know you. And that's called a relationship.
Mm-hmm.
So my history of surgery, and I'd never been in a hospital for anything, by the way. My history of surgery and being brought through that, and what I am going through in this whole MDS, acute myeloid leukemia, it's just me and God, and on a relationship with your Heavenly Father. Now, support-wise, I didn't tell anyone but my immediate family.
Okay.
I have thousands of friends.
Mm-hmm.
But I knew if they had known my situation, they would have been texting me. They would have been calling me, how you doing? So I kind of cut them out, but, you know, people find out things.
Right.
But my support has been my wife, Marguerite.
Mm-hmm.
I couldn't have asked for a better caregiver.
You're right.
Meds, making sure I ate right. And here's another thing. You don't have an appetite when you go through this. You eat because you know you have to eat for nutrition.
Gotta eat.
You have to eat. There would be times where there'd be nothing on the plate, little bit of this, a little bit of that, and it looked like it was a monster full of food. The plate would look so enormous, but I knew I had to get that down. I had to.
Mm-hmm.
But I could not have asked for a better caregiver. I could not have asked for a better support system.
Mm-hmm.
I could not ask for my nieces, my nephews, my cousins to drive me back and forth to appointments.
Right.
When I was told after the bone marrow transplant and I was released that you can't drive for 100 days.
Oh, wow.
What?
Mm-hmm.
So that was just traumatizing to me. You know, you might as well cut a leg off. But I made it through that. And thanks to Marguerite driving me back and forth. And in Charlotte, the traffic's horrible.
Okay.
So it was taxing to Marguerite, but she did it.
Mm-hmm.
She did it for me. We did it together. My nieces, nephews, cousins, friends, they drove me
Mm-hmm.
to give Marguerite a break. You just need a strong support system.
Right. That's very important.
And people that show love, people can tell you, I'll be there. Let me know. You need anything, let me know. Okay, well, guess what?
Anybody could say something.
Action and words are totally different.
Yes.
So, but God put the right people at the right place at the right time, all the time.
All the time.
All the time.
Right on time.
So currently, I've had. Well, let me go through this. I've had probably 7 or 8 bone marrow biopsies. You know the deal with bone marrow
those.
Well, I had one bad one in New Jersey. I had a terrible one in Charlotte. And then I found out through Dr. Grunwald that they could give you a CT-guided biopsy where the needle is guided, you are numbed, you feel nothing, and you're home free. I could do a bone marrow biopsy now like eating a bag of peanuts.
Man, that's crazy. I have to tell you this. I have to tell you the story about my bone marrow biopsies. So like you said, you had like a few bad ones.
Yeah.
So the first one I ever got, this is a crazy story. I was getting ready for the transplant and they had to test my bone marrow to see if I had Hodgkin's lymphoma. So it's in my lymph nodes.
Mm-hmm.
So the next part of my treatment plan was to do a bone marrow transplant because the treatments hadn't worked up until now. I still had some cancer left in my lymph node in my chest. And so, to do the transplant, they test your bone marrow to see if you have cancer in your T cells in your bones. Right? That's the point of the biopsy. And so I'm getting the test done and they asked, do you want pain meds? And I'm like, no. Well, no. This is what I asked. I said, well, do other people, I'm competitive. Have other people done it without pain meds?
Oh boy.
Yeah, the people have done it without pain meds. Oh, I can do it. I can do it. Right. So I come in, and even the day of when I come in and they're, oh, you're not taking, no, I think I'll be okay. And so I'm getting the procedure done. It's very painful. Mm-hmm. Probably some of the most pain I've ever felt, but I was able to just breathe through it. Right. They numb the spot. You can't numb your bones though.
Right.
You can't numb your bones. And so she goes in. My mom is there watching, but she goes in. I'm basically laying on the table. She's pretty much putting her body weight and like screwing into my bones. Yeah. Right. And I can't see it. I'm just on the table getting through the pain, breathing, like very deep breaths, like just taking the pain. Like I just decided no pain med. I don't need no pain meds. I'm hard like that. So she does the procedure and is like, I didn't get the sample. We have to do it again.
Oh, man.
Okay. I said, okay, we do it again. She screws into me. She does everything, comes back. We didn't get the sample. We have to do it again. So this is the third time. The third time she finally gets the sample. And whatever. Even afterwards, I went and played basketball. Like, it was not something that, like, it wasn't, like, still painful afterwards. It was just during,
the process.
While they're drilling into your bones,
yes,
it is very painful. And so, long story short, she ended up telling me I had the hardest bones she's ever tested in her life, which I guess was a compliment, but was just the worst problem, was the worst situation to have very strong bones. And she's a doctor. She does this very normal. This is a normal standard procedure that she does. And she could not find that. After that, because I requested somebody else do this the next time. I was like, no way we're going through this again. And the doctor that did the biopsy the next time, he used a drill, which was way simpler. There was one time, so I don't remember exactly how many bone marrow biopsies I got, but there was one because the first couple, even though it was a process and it didn't get right away, there was one time when they pulled and I could feel it. I could feel it shoot all down my leg. That was one of the weirdest feelings I ever felt. And so that was different. I like you, I dread those bone marrow biopsies. But that's cool. They were able to do a CT guided.
Well, let me tell you what happened.
Okay.
The first bone marrow biopsy I did in New Jersey, I was not warned or told about the pain factor.
Right.
I was numb topically, but these needles are 10, 11 inches long sometimes. And all of a sudden, bang, and he hit bone. And you feel that. You feel that in a harsh, very, very harsh way. So the next biopsy I had was here in Charlotte at Novant.
Okay.
I was laying on a table. Now, you mentioned that they told you you had very hard bones. Never experienced anybody with hard bones like yours. That's a cliche, because I got it too. So I'm laying on the table. In comes doctor number 1 to try to get into my bone. Can't get it. They call in doctor number 2. They're trying to feel the pressure. Can't get it. Here comes doctor number 3. Sheesh. Doctor number 3 comes in. He has his knee on the table trying to push down, through, and into my bone. Mm-hmm. And all of a sudden you hear this conversation with Doctor 1, 2, and 3. Boy, this guy has some very tough, hard bones. And then they said, do you take vitamin D? Just get it done. So when I literally had another bone marrow biopsy scheduled, Dr. Michael Grunwald mentioned that there is a CT-guided scan bone marrow biopsy option, which is, I told him about the 2 bad experiences, and he told me, well, there's options. So, when they tell me now, bone marrow biopsy, okay, look, what time, when? So there are good experiences and bad experiences.
Right.
But the one thing that this whole MDS, leukemia disease has taught me is patience. Mm-hmm. You have a lot of time to think when you're lying in a hospital room for 27 days, even though it could have been 33. Mm-hmm. But it's humbling. There are days when you're lonely. Mm-hmm. There are days when you're having conversation with yourself.
Yep.
There are days when you're singing hymns that you learned when you were 9 and 10 years old in church, in vacation Bible school. I was raised in the church, so I had a very strong faith and background and relationship with Almighty God. Mm-hmm. So you remember things like playing after school, riding your bike. You got time to think about all kind of things. But when you lay your eyes on that God's got this, when you're in that room, you don't question that. Mm-hmm. There's no fear. I once heard a minister say, okay, we're coming to altar call. Come on down for altar call. People getting up, going down to the altar for prayer. And he says, you can't come down here asking for prayer and leave and take whatever you came down here with back to the pew. You can't.
Right.
So when I say God's got this, you can't question that. You got to give it to him and leave it with him. And he'll do the rest. There was a woman when I was a young man, not even a young man, an adolescent in Brevard, North Carolina, at Bethel Baptist Church. A woman, Miss Johnson Lee Mills, used to sing this song, One Step. And the song was, if you take one step, God will do the rest.
Okay.
And that one step is letting it go and giving it to him. If you can do that, you're straight. You're straight like 6 o'clock. You are. And my faith has made me whole. There's a story in the Bible about a woman with the issue of blood.
Mm-hmm.
She had this issue with blood for years. And the next thing you know, Jesus is in town and he's walking through and performing miracles. And there's a crowd. She can't get to him. And he passes, and right as he passes, she touches the hem of his garment. And he immediately said, who touched me? She was immediately healed. While I was laying in that bed, I would touch the sheet. I would touch my pajamas. I still do it today. I could be laying in bed. I could touch my shirt. Keeping in that same mode of thinking, that healing.
Mm-hmm.
I have a friend who calls me the miracle man because of what I've gone through. I'm not the miracle man. The miracle man is God Almighty.
Mm-hmm.
That's the miracle man.
Right.
I'm just a recipient of the miracle.
Mm-hmm.
So without faith, without family support, without my loving caregiver, I can't give him enough credit.
Right. And that's like, for me, that person, that caregiver is my mom.
Mm-hmm.
And my mom, man, she probably took this a little bit tougher than I took it. You know, going through it, right? Being on the outside, I could only imagine not having like any control.
Yeah.
Or really understand it just is happening. And right, I'm her only son. I have a little sister. And so, right, like she's seeing that. And my mom is a fixer. Like she wants to fix the problem. She just wants to, what can I do to fix it? What do I need to do? How can I act?
Yeah.
And make this better? How can I solve this problem? She's a problem solver.
Yeah.
And so this was a problem she couldn't really just solve, right? There wasn't nothing that she could just do to just snap her fingers, pay some money or something and figure this out.
Yeah.
Right? It was something that we both went through together. And right, like you said, she's giving me rides to my appointments.
Mm-hmm.
You know, after the transplant, you can't drive. She's driving me home. You have to eat. You're on a strict diet now. You have to eat at home now. Yeah. So you need somebody to cook you food. Yeah. I know after my second bone marrow transplant, I was like a vegetable. I couldn't even get out of bed some days till into the afternoon because I'm getting weaned off of steroids. So like I have my energy levels are weird and my hormone levels are weird inside my body, not giving me the things I need to just have energy to simply. I remember at one point I would go on walks with my mom. I got out of the hospital April, March, May, like June. Yeah, like June on the second transplant. I'm in Oregon. So it's summertime, so it's pretty nice outside. Yeah. And I just want to get outside. And it's again, this was a little bit during COVID. And I remember I could barely walk around my cul-de-sac in my neighborhood. I could barely walk, like get up and just take a walk.
Yeah.
around, and now I run like a mile every morning.
Yeah.
Right. And
Yeah.
I'm
Good
back
for you.
I'm back
Yeah,
in
yeah.
shape again.
Yeah.
But during that time, like I was just so weak. And if I didn't have like my mom or like your wife was for you, I would be nothing. I wouldn't have
Yeah.
been able to figure it out. I wouldn't have been able to get. I have supportive neighbors. One of my I talk about this. One of my good neighbors, Stuart. His daughter his daughters are the same age as my little sister, so they played sports together. We all grew up in the same neighborhood. But he would make me meals. He would make me food.
Yeah.
All the time, man. My cousin, my uncles, my people. My support was such a big deal during this whole thing, and that got me through.
Yeah.
Right. And like you said, not just your support from your people, but your support from your relationship with God.
Yeah.
Really, just that belief, that confidence, that mental really was the driving factor and through getting me what you would say is a miracle.
Yeah.
You know what I'm saying?
Oh yeah. Absolutely.
And so yeah, we're living proof of that all what you believe in and then that works.
Yeah.
So I wanted to touch base real quick on how did you feel about your, I know you got in real good with your oncologist and your diet. So how did you feel about the care that you were getting from your doctors or from the people at the hospital doing your transplant? Like how was your confidence in them and how did you feel about the care that you were getting?
Well, the first thing that when I was diagnosed at Novant, and Dr. Croft told me, she says, and these are her very words, "You're gonna be just fine."
That's cool.
That was so comforting.
Yeah.
For someone to say that to me in the position that I was in. You're gonna be just fine.
Mm-hmm.
She also said, "We know what we're doing."
Mm-hmm.
That's so reassuring. And then when you know that you got your backup, regardless to what man says, when you got your backup and your mantra that God's got this, you're home free.
Mm-hmm.
When I met Dr. Grunwald at Levine and found out that he's done hundreds and thousands of bone marrow transplants, there's God again, making sure you're in the right place. So, as far as the care, you will never meet a more compassionate group of medical people as you find in the oncology, hematology department of Levine and Novant Health.
Okay.
They just care. It's a different type of care and concern. I see people that come there who have any number of different cancers. One of the benefits, if there's such a benefit, of going to a cancer institute is there's valet parking every time you pull up. I've seen people yelling at these people who are valeting your car. You're coming here to be treated for cancer and you're giving this guy static? I mean, come on, wake up.
Right.
But the answer to your question is the care, I could not be receiving better care. When I hit my appointments, I walk in every day when I pass the nurses' stations. Good morning, ladies.
Yeah.
Everybody knows me.
Yeah.
Everybody knows me by Mr. Betsill. Everybody treats me. I mean, I bring light into a room. I mean, that's just my personality. But when the nurses are fighting over who's going to treat you today,
Yeah.
you got something going on.
Yeah, I get that. I get that. I was always a light, being like I'm always the youngest person in any cancer situation I was in, right? And I'm just like a very positive person. And that's how I really approach this whole situation. And so I get that, being appreciated by the nurses, that helps you too.
Yeah. I mean, they're having a rough day as well.
They doing a lot.
Something? I've never, as I walk out of that infusion center, and that's 3 times a week, when I walk out of that infusion center, I see people in a lot worse shape than I am. And as I'm walking, I do this every time I'm walking out of that infusion center. I'm saying a mental prayer for those people that I'm passing. If God did it for me, he can do it for anybody.
Right.
So it's just a journey. The term journey was mentioned to me when I was first diagnosed. And the journey is long. I have 8 o'clock appointments 3 days a week, most times. In Charlotte, that involves rush hour traffic. Patients and bad drivers, that's rough to deal with. So when you get there, the first thing they do when you sit down is take your blood pressure. Okay, I just drove 25 miles in 5-mile-an-hour traffic, and everybody's cutting you off or not letting you in.
Right.
So, but going back to your question, the care is unbelievable. And kudos to all the people in the hematology oncology department of Levine Cancer Institute. They really care about the care that they're giving you.
Yeah.
There's no nasty nurses.
That's blessed.
That's an oxymoron in that department.
Yeah. And I can't thank all of the nurses enough for all the nurses that have taken care of me and helped in my journey as well. They do the most to make sure you're comfortable, especially during those stays in the transplant, right? They're there 24/7.
Yeah.
Helping me out. Some of them are overnight, you got a call button if you need something,
yeah.
right?
Oh, yeah.
They're on call.
Yeah.
And so, what they do is amazing.
Yeah.
And I really appreciate that.
Great sacrifice that they make to make you comfortable and feel needed.
Yeah.
They when I found out that I would be given 444 million stem cells, and the day that they brought those stem cells in liquid nitrogen, and you look over and they take the stem cells out, and you see the evaporation, from when they open the container. It's like science fiction. And to be given 444 million stem cells in a matter of 18, 20 minutes.
20 minutes, yeah.
Yeah. And you're thinking, man, technology. And then you think, God's got this.
God's got this. Man, and that's crazy technology. So this is the last point, and then we gotta wrap it up.
Okay.
But so for me, I got 2 transplants.
Mm-hmm.
The first bone marrow transplant, I gave myself my own cells. And so it was way more of a seamless transition, and the recovery process seemed way smoother. I'm not totally sure why, but it didn't even work. It didn't even work. After that transplant, I ended up doing an immune therapy treatment that got me into remission eventually. The second transplant I got, I now live with my dad's cells, we
Okay.
did what's called like a half match transplant.
Mm-hmm.
And originally, the 3-4 years before when I did the first transplant, that was not even an option. That's how fast like technology had evolved
Yeah.
in those couple of years. And it gave me another option that cured my cancer.
Mm.
Right. And that's crazy that you got a full match. You found a full match.
Full match.
There's no way I could find a full match.
Full match.
I'm like half black, half Korean. Like nobody is matching my blood. Like it's not out there.
No.
Right. And so, yeah, I'm just blessed that the technology sped up enough and was able to service and get to a point so that we could do half matches. And here I am today,
Yeah.
you know, living in remission.
Thank
So
God. Thank God.
again, and I always say God's time. I always say perfect timing, right? And you could say that's like God's timing.
Yeah.
I know, like growing up, my dad and I sometimes we kind of show up a little bit late to like a barbecue or something, right? And he always be like, I would kind of stress as a little kid, like, we're running late. We gotta get. I want to like play with all my cousins and stuff, right?
Yeah.
We're gonna get there late, right? And he's always like, we're right on time, and that's always stuck with me. And as I've gotten older, I've learned to, you know, with my faith in God, and really understand that like everything happens for a reason, right
Absolutely.
on time, with perfect timing, and to trust that and be patient for that.
Yeah. Patience. I've been taught great patience.
Yes,
Great and I was one of the most impatient people on the planet.
I like to just get it done.
I have a T-shirt that states "No excuses." I have a second T-shirt that says "Get it done."
Get it done.
In the second grade, I was told by my second grade teacher, if a task is once begun, never leave it till it's done. Be the labor great or small, do it well or not at all. I live by that.
I love that.
I live by that. And then, you know, Marguerite used to say to me when we were in New Jersey, I'd be out in the yard, I'd be riding the bike, I'd be like, sit down, you're making me tired. Go somewhere and rest. I've just been a person of energy all my life.
Hey,
all my life.
I love that.
And to be able to have to sit and not be able to do anything teaches you patience.
Yeah, because I go till I crash out. I go hard until I can't, until I have to rest.
Yeah.
You know, and especially now that I've been through what I've gone through, I really go hard.
Yeah.
You know?
Yeah. Yep.
And but yeah, I like going all in.
Yeah.
And I like, you know, winners never quit and quitters never win.
Yeah.
I really believe in that.
One of the things that I was unable to do, and I love gardening and being outdoors, period. But, you know, doing this whole MDS leukemia scenario, I was unable to do any of that. All I could do during last spring, last summer, the fall, was look out the window and say, when I get better, it's not if I get better. When I get better, I'm going to do this, I'm going to do that, I'm going to plant this over there, I'm going to make sure those leaves are, rake those leaves over in the corner that's been there for a year and a half. We bought a house, and 6 weeks after we moved into the house, I was diagnosed. I couldn't do anything.
Wow, yeah, that's crazy.
So, you know, I says I got some things to do. And they're done.
Yeah.
By the way. They are done.
That's good.
Yep.
That's good, man. All right, man. Well, that's all we got today on this episode of Beast vs. Zombie. Thank you, Larry, for coming on and sharing your story with us.
Thank you for having me.
This is inspiring, man. And I hope everybody that's watching this and listening understands Larry and I, we're just normal people, just like you guys are. We're dealing with everyday challenges just like you. And if we can overcome what we've gone through, you can achieve anything. Anything that you have going on, you will overcome, and you can come out on top. So everybody have a good day. Be a beast.